Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. Today is December 22nd. My name is Tracy Smith and I am here as always with Dr. Stuart Kennedy, Incident Manager. Bit of an exciting day today, Dr. Kennedy. We administered the first COVID-19 vaccine in our community. Cases are coming down a little bit. We have 98 active cases in our community. We have no active cases in our hospital. And the province did announce yesterday a lockdown across Ontario to help bring numbers down and reduce spread. What are your thoughts?
Well, they obviously didn't look at Thunder Bay, how well we're doing, didn't they? So from our perspective, it is a good day. I mean, vaccines are here, but let's not get so enthusiastic about the vaccines that we forget to not practice the public health measures over the next many months. So you still got to keep your physical distancing, you still got to wash your hands, and you still got to minimize your bubble. And so certainly that's the most important message we want to give post-vaccine, but isn't it great to get the vaccine to our sort of frontline workers working in those long-term care homes? So certainly I applaud the province and I applaud the hospital for moving that initiative forward. But again, I mean, the lockdown through Ontario is a good thing because the hospitals in southern Ontario are overloaded, expanding, healthcare workers are getting ill, and they really need to be prudent about delivering good, safe care in a hospital with capacity. Having said,
what about our hospital here? Will there be any impact to services at our hospital?
There'll be no impact to services whatsoever. We're still doing our surgical procedures, and they're slowed down a bit for Christmas and the holiday season, but they'll be ramping back up. We're still doing our diagnostic procedures. So if you have an appointment, make sure you show up because we're still open for business. The only service that's going to be affected is our gift shop because it's a retail outlet. Will be closed until January the 11th, and that'll be starting on Christmas Day. So, but right now, getting back to Southern Ontario, I mean, we have less than 80% occupancy, which is great here. We have no COVID patients in this hospital, which is great here. So certainly Thunder Bay has done a great job, and our numbers are coming down. We have 98 in the community, positive COVID-19 patients, but everybody are following the rules. So thank you, but continue to follow those rules over the Christmas holidays. It's very, very important.
Now, speaking of following the rules, as we look at this lockdown coming our way, what does the impact have on patients who are admitted to our hospitals and their essential care providers?
Nothing has changed. We went through the document this morning about what needs to be changed given the direction from the Ministry of Health and the government, and nothing has changed. We'll still have our essential care partners in place for our palliative care patients who are individuals who are dying, our pediatric patients, our women giving birth, our patients with cognitive and mental health or behavioral issues, patients with communication needs, patients in the intensive care unit. We are taking all those needs into consideration. So our standards for essential care partners certainly are going to be maintained. We can expand them. I got a lot of requests because it's Christmas. Will you let my grandson into the hospital? No, we can't. This is going to be essential care partners only. It's one Christmas. It's certainly a major concern from many patients and families, but it's the right thing to do, protect this one acute care hospital here in Thunder Bay.
Yes, appreciate that it can be difficult for some, but again, as you say, the right thing to do. So those who have loved ones in the hospital and already are essential care partners, no changes to them.
None whatsoever.
Stay safe this Christmas. See you again soon.
Merry Christmas.